It's called Filling Down, an easy read guide for people with learning disabilities, which is primarily about well-being, but also about how to look after your mental health. So what the aims were primarily to raise awareness about mental health matters for people with learning disabilities. And we were particularly interested in raising awareness within health professionals and also frontline staff. We wanted to develop a picture of what is happening now in terms of people's mental health. And we did that via a little survey, which gave us an insight, and interviews that gave us an insight into what families and people with learning disabilities felt. We produced, and also the thought was that we would produce some guides. And a lot of our materials is usually in easy read. So we do tend to try and make sure that things that we do are accessible to people with learning disabilities. The guide came up because what was coming up quite clearly is that people were saying that their biggest barrier, GPs were fantastic, but their biggest barrier was that they couldn't get the GP and their frontline staff to really believe them and to listen to them. And it became a sort of a difficult situation for them. So they needed something that they can give their GP to really believe them, that they were sad and there's something wrong within their life. So they wanted something that would help them. And that's what they called it, a survival kit for visiting your GP. But we decided that title, forgive me if there's any GPs here, we decided that might not be appropriate to call it a survival kit. So we called it a GP information pack. And people can use it. It has relevant information in it. It had information about their medication. It has a feelings diary, so they can start to look at what they were experiencing, so that they can explain it to their GPs. And it also has information about maybe if they have pain or feelings in their body and where those feelings were, so that they can have some information that they can share and say, this is how I'm feeling and this is how I've been for a while, which is different to how I am now. So please help me, don't ignore it, just send me away. But what everybody agreed, and what people said, is the rights of people with learning disabilities, is that they should have the same right as anybody else to good physical health and mental health, that it should be a right. And these are some of the things we know, I'm not going to read it, is that 1 in 4 people with learning disabilities do also have mental health issues compared to the general public, and it's a higher incidence to the general public, 3% schizophrenia, and even higher for families from the South Asian communities. So 40% is something that was quoted in the No Health Without Mental Health. And one of the things that they said, particularly when they mentioned learning disability throughout the document, and one of the things they said is that they would want to see significant change in the way people's mental health was supported. And from our report, maybe from our recommendations, one might say, how far have we moved on? Although the research was not as big, it does really raise some issues, particularly about diagnostic overshadowing, and people still thinking that people were feeling the way they were because of their learning disability.